Cardiovascular disease, and specifically heart failure, is the number one cause of death in men and women across just about every demographic.
For the last half-century, scientists have been working tirelessly to create a machine that can accurately mimic the function of a beating human heart. Envisioning devices they hope will one day rid us of the number one cause of death in the world.
Only now in the last decade or so have we had the technology to make devices that potentially could last a decade or more. If we had a practical, permanent, total artificial heart, it would be one of the biggest accomplishments in modern medicine.
For a limited time, you can get up to $250 in crypto bonuses when funding a new account on BlockFi, where you can use cryptocurrency to earn interest, borrow cash, and buy or sell crypto. If you want your free crypto, use the link in the description.
When it comes to heart failure, there's currently only one gold standard of treatment, replacing the failing heart with a healthy donor. And while there are nearly 6,000 heart transplants done annually, there are about 1 million requests for donor hearts each year, 600,000 of which are in the US alone.
So the main limitation to heart transplantation is having a donor heart that we can place in a patient who's destined to die from heart failure. And if you think about it, it's got to be a healthy heart from a patient who's died in such a way that it didn't affect their heart. And that doesn't happen that frequently. So to be able to save the lives of all these patients that are dying of heart failure, we need something other than a transplanted heart. Your heart's just a pump. So a heart is a very, very simple device by some metrics, but incredibly complex by others. So a lot of scientists looked at the heart function and tried to mimic it. April 4th, 1969, that was the world's first clinical use of a total artificial heart.
The possibility has now been established as a reality, the fact that Mr. Karp has regained organ function, mechanical heart, is a feasibility.
Unfortunately, the valves that they'd put in this version of the heart were breaking up the blood. The broken up blood was causing the kidneys to fail. And after 64 hours on the device, they did an emergency transplant. And tragically, 36 hours later, died of an infection. Based on that technology, that device continued to evolve and evolved into what we now have, the SynCardia device, which is the world's first approved device, just like the one implanted in 1969, but much better membranes, much better valves, much better material and manufacturing techniques.
SynCardia and Carmat are the only approved artificial hearts in the world right now, but they're currently approved only as bridge-to-transplant devices, temporary hearts that work to keep patients alive until a real donor heart becomes available. The longest an artificial heart has ever lasted in a patient is 1,374 days, or roughly 4 years, the real limitation being long-term durability.
Think about it now. If your heart is beating 80 times a minute, that's 132,000 times in a day. That's 42 million times in a year. Anything that has to flex over and over again to make it so it never fails, I think is a tall order.
The durability factor has led other groups to rethink their approach to how an artificial heart mimics our own. Bivacor, a startup from Brisbane, Australia that's headquartered in Houston, Texas, has come up with a device that hardly resembles a human heart at all. Their radical new approach has helped them to raise more than $20 million.
The artificial heart that we're creating is what's called a rotary total artificial heart, which has a spinning disc which is magnetically levitated within a cavity to pump the blood to both the lungs and to the body simultaneously. It's a similar process to a fan where your ceiling fan will spin and air will come down at a constant flow rate. Instead of air, we're pumping blood. A spinning disc that is magnetically levitated, meaning that there's no touchdown of any of those moving parts, can effectively last forever.
Bivacor's artificial heart works off of rapidly spinning pump technology developed by scientists Rob Jarvik and Rich Wampler in the mid-1980s. In their device, small turbines sat outside unhealthy hearts to assist with blood flow to a single ventricle. Tim's device builds on that idea by using a spinning disc, or impeller, to push and regulate the flow of blood to both ventricles. Bivacor is currently testing its device in this system that circulates liquids to replicate the functions of the human body. There's one big question, though, that they won't be able to answer before human trials: whether Bivacor patients will have a pulse. While we tend to think of the pulse as fundamental to the heart's function, Bivacor's device can actually propel blood in a continuous stream, which works fine in the lab and in animal trials, but no one knows exactly what its effects would be on the human body, so Tim's is exploring other options as well. Eventually, Bivacor intends for these changes in heart rate to be automatic, based on blood pressure changes that occur when a patient moves from one type of physical activity to another.
This is a project that I've worked on now for almost 2 decades.
Bivacor is currently working with the FDA, undergoing durability and animal studies. They're also poised for their first human implant to take place in 2022. Meanwhile, France-based Carmat received approval from the EU at the end of 2020 and has started manufacturing its hearts for commercial sale. Hopes are high that Carmat's heart will prove longer lasting than earlier artificial hearts, and the company intends for its product to eventually become a permanent replacement, not just a stopgap. As promising as these technologies are, one big remaining downside is the briefcase-sized power packs that have to stay permanently connected to the hearts through the patient's skin. Advancements like extending battery life and replacing cable drive lines with wireless charging technology would have to be realized before an artificial heart patient's freedom is truly on par with a healthy transplant recipient.
It's a whole bunch of technical forces that are converging on having an artificial heart that lasts a long time, that doesn't have a wire through the skin. And then maybe heart failure won't be the #1 cause of death in the world.
For a limited time, you can get up to $250 in crypto bonuses when funding a new account on BlockFi, where you can use cryptocurrency to earn interest, borrow cash, and buy or sell crypto. If you want your free crypto, use the link in the description.